Good afternoon. Committee, today is Tuesday, January 30th. This is the Finance Committee. We welcome you to the committee. Today our hearings will begin with number 1 will be Senate Bill 220, then Senate Bill 222, number 3, Senate Bill 246, number 4, Senate Bill 212, number 5, Senate Bill 241, then Senate Bill 242, number 7 is Senate Bill 218, number 8 is Senate Bill 221, and then we'll end with Senator Muse, Senate Bill 151, and Senator Jackson, Senate Bill 3. So that's our lineup for today. As you come forward to testify, the sponsor gets as much time as they need. And if there are panel members, they'll each get 2 minutes. And please introduce your panel and bring them up with you so we know who the panel is and we can check our list. So thank you everyone for being here. And we'll start with Senate Bill 220. I believe, is that Dr. Kalyanarama? Are you Senate Bill 220? Please come to the table. Thank you.
Right. Good afternoon, Chair Beidel, Vice Chair Klausmeyer, members of the Finance Committee. For the record, my name is Dr. Nilesh Kalyanaraman. I'm the Deputy Secretary for Public Health at the Maryland Department of Health, and I'm here to testify on behalf of Senate Bill 220. This is a departmental bill that contains 5 components to improve, align, and streamline our work at the Maryland Department of Health. 1, this bill would align Maryland law with federal law concerning the sale of tobacco products to active duty military personnel under the age of 21. So the General Assembly passed our Tobacco 21 bill before the federal government did, and our statute includes an active duty military exception that the federal law does not allow. This bill would align us with federal law and protect the health of younger service members. The second is allowing MDH to shift unspent cancer prevention, education, screening, and treatment from counties that cannot spend them in a fiscal year to counties that can use the funds to serve residents in that fiscal year. The third is to allow MDH to eliminate a redundant report. So currently MDH has to submit a report on our CRF, cigarette restitution funds, counter marketing and media activities, in addition to our comprehensive annual CRF report, which includes this information. So eliminating the redundant counter marketing and media report would help streamline our reporting without compromising any information to the legislature. Fourth is allowing MDH to eliminate a redundant panel. So MDH has been required to convene an expert panel on child abuse and neglect and submit data annually. This bill would require the State Council on Child Abuse and Neglect to coordinate with the Child Abuse Medical Providers Initiative, that's CHAMP, to include data on child abuse and neglect as part of their work and as part of the council's work. And lastly, this would transfer responsibility for the payment of claims for emergency medical treatment for abused and neglected children from MDH to the Governor's Office of Crime Prevention, Youth and Victim Services. This would align state law with existing practices as they have been processing and paying these claims for several years now. These changes will help improve health and streamline work to allow us to better serve the residents of this state. Thank you for your time.
Thank you, Dr. Kaye. Do I have any questions on this bill for Dr. Kaye? Senator Reedy.
Thank you, Madam Chair. Just a quick question. One of the revisions you mentioned and are talking about is dealing with the military. Is that a change that's been required by any other change in law, or is that just a recommendation you all are making at the state level?
So the federal law does not allow sale of tobacco products to anybody under age of 21. And we get constant both inquiries, but we also have to negotiate the regulatory aspects of that, which is reconciling that our state law is not in compliance with federal law at this point.
Thank you. And are there other areas where our state law isn't in compliance with federal law in some of these revisions, or is that?
In the other revisions that I'm mentioning here, I do not believe any of those are related to conflicts with federal law.
Okay. My question is because we actually had a very specific policy debate in the General Assembly about that amendment, and both bodies overwhelmingly approved it. So I was just curious about the recommendation, and I had heard that the feds were doing something. So I was curious what the nexus is. Thank you very much.
I have a question, Dr. Kaye. How about on base, like the PX? Will they be able to sell to the military under 21, or are they also going to be under this federal
Well,
regulation?
I'll have to make sure, but as I understand, since they're under federal law, they would not be allowed to be selling that at this time.
Thank you. Do I have any other questions? Oh, Senator Hershey.
Thank you, Madam Chair. Yeah, just to, again, get a better idea, is this a requirement that we have to do it?
It is, so when you say a requirement, is it we are right now in conflict with federal law,
Right.
and it's leading to issues with how we are able to do our compliance work and about how we are expending our federal funds around this. So right now, when we have tension between federal law and state law, we're trying to reconcile and resolve that.
Okay, so, but we're not required to, I mean, federal law is not mandating that we make this change.
I'd have to get back to you on the exact, like,
Yeah.
I guess I'm not clear on what.
I guess let me ask the question. If we didn't pass this, what happens?
We continue as we are, which is that we have tension in terms of our ability to apply and use our federal funds to conduct our compliance checks that are federally required as part of our grants.
And those
And-
compliance checks are with respect to what?
The sale of tobacco products to youth under the age of 21, right? But right now we have that window where between 18 and 20, we as state law have that exemption for military service members, whereas federal law does not grant that exemption.
So you mean compliance checks outside of military?
Yes,
State.
outside of, yes,
So
not
you're
federal
saying-
facilities.
Okay, so you're saying that in order to do checks everywhere else, federal government provides some funding to help you do that.
Mhm.
And because we're in conflict right now with the military requirement, you don't get the ability to use the funding to make those checks elsewhere. Or it's more
So,
difficult.
right, and under state law, right, for an 18 to 20-year-old service member who tried to buy a tobacco product, they would be allowed, the facility would pass our compliance check for state law, but fail for federal law.
Right.
And when we report this up to the federal, when we report this up for our federal reporting, that creates a conflict that we are truly not in compliance with federal law,
Right.
but how do we reconcile that at the state level?
Okay. All right. Thank you very much. Thank you.
Thank you, Senator Hershey. Next, I have Senator Ellis.
Yeah, thank you, Madam Chair. Doctor, so it's very much, I understand the kind of confusion. I'm not clear. So the intersection of federal and state law, that's always an interesting intersection. So other states, or if all the other states are at 21 with the federal law, or are there other states who still keep tobacco product at 18, and what are they doing in reference to this federal law?
I'm not clear as to what how many other states have this exemption at this time for service members between the ages of 18 and 21, but I can get you that
Yeah,
information.
not necessarily exemption, but how many states, are there any states that tobacco use is at 18?
I'd have to get you at this point. It's very few,
Very few?
Mhm.
Like
but I'd
Virginia.
have to get you the number. I don't want to misquote a number to you.
But there are few out there.
Mhm.
So there, like in Maryland now, if you're in the military, show a military ID, you can buy tobacco products in that 18 to 21 donut hole, right?
Mhm.
Yeah. And so, yeah, what I'm concerned about being a veteran is individuals in other states, stationed in other states, they can buy tobacco products.
Mhm.
It's legal, and they come to Maryland. I know it's not a habit I encourage, but they come to Maryland. They can, they have a desire to smoke or
Mhm.
habit, and they want to buy smokes, but they can't, and they have that habit without going through a cessation program.
Mhm.
I mean that exemption was carved because of that. So we don't want them come to Maryland automatically trying to do something illegal.
Mhm.
And that's my concern. And I'm not sure where the intersection with federal law and state law in other states and service members transferring continually around the country and the world, and and we put them in a immediate bind without giving them a off ramp through smoking cessation or something like that. So have you thought about that particular issue with individuals coming into Maryland military every 2 years? They get, on average, they transfer, and if they can smoke in other states and come here, and all of us have to go cold turkey. Have you thought about that?
Yeah, I think there's
So-
there's two pieces to that, right? One is the federal law. The federal law does say that anybody under the age of 21. So that starts leveling the playing field at the national level. And the second is that we've invested a lot of resources into smoking prevention and cessation as well. And there are ample resources to help with quitting smoking. Probably number one is their smoke and quit line. But we have resources, and we'd be certainly happy to talk to our military partners on what their programs are as well. And I know those programs are part of the federal government's work.
Yeah. Okay. Yeah. Thank you. If you could reach out to me with that.
Yes,
And
absolutely.
to the states that under 21 can buy legally, and how they interact with the federal law and stuff like that. I'm interested. Thank you.
Okay.
Thank you, Madam Chair.
Senator Ellis, thank you. Senator Hayes?
Thank you, Madam Chair, and thank you, Dr. K. I'm gonna depart away from the advocacy around underage smoking and take to the part where you're talking about, so you all eliminate the language where it says the Secretary of Health in the family law section, and replace that with the Executive Director of the Governor's Office Crime Control Prevention, for the sake of it. It appears to be health benefits. I've always seen like that office, I think some people refer to it as GOCAP, has had so many name changes, I don't recognize it anymore. But I know the governor just had an executive order reestablishing this. Is this as a result of the new defined office and a greater role versus, and a departure away from the traditional role that is played as a coordinating agency?
So no, this change is not related to that at all. This is something we had been working on and had developed prior to that announcement. We have followed up with them since that announcement, and they are going to continue to be able to perform this function as they do now. And so there's no, from their standpoint, even after the announced change, there's no issue with this.
And so we have cases where they're providing direct services, because this line says something where the child's parent or guardian is liable to the Governor's Office of Crime Control Prevention and Youth Services for the payments and shall take any necessary steps to secure health benefits. They have the ability to have direct services.
So what they're doing is they're paying for the direct services.
They are paying for the direct services on behalf of the family.
Yes.
Gotcha. Thank you, Madam Chair.
Thank you, Senator Hayes. And now I think last, Senator Mounts.
Thank you, Madam Chair. And I'm going to go back to the tobacco under 21 for active military personnel. And I too remember this discussion. It was long, and it went on and on. I don't want to continue it too much further, but so the federal government has put in this requirement. So if active military personnel has tobacco, they're under 21, they have tobacco, they're in violation of federal law currently. Right. And so that would have to, well, what is the punishment for that?
I don't know the punishment for possessing tobacco products under the age of.
Because the way I see it is you're active military personnel, the U.S. attorney probably would be the office to prosecute that. They're not going to prosecute that type of case. I wouldn't see that. But if we vote for this, then begs the question, if you're active military personnel and you're under 21 in Maryland and something goes awry, there's a potential they could be prosecuted or cited by local authorities. Is that accurate, or am I missing something?
I don't, but so the purpose of this isn't to put any onus on service members or the public. Actually, this is towards retailers not selling it. So the onus is entirely on retailers who right now cannot sell tobacco products to anybody under the age of 21 with the military exception, right? And so from our standpoint, this just closes that last door for the retailers. This doesn't say anything about service members or other members of the public.
So it's just geared more towards retailers than it is active. What is the punishment? What is the penalty for underage possession of tobacco?
I would have to get back to you on that. I do not know the answer to that question.
I'd be interested to clarify that. Thank you.
Seeing no other questions, we do have another witness to testify in favor, and it is Blair Innes. Dr. K, you can stay. I think you're going to have the next bill too. so
Yes.
Thank you.
Good afternoon. My name is Blair Innes. I am the Deputy Director of the Legal Resource Center for Public Health Policy, here to testify in support of Senate Bill 220. And actually, I was here to talk about the military exemption. When Maryland passed Tobacco 21, we actually did it a few months before the federal government did, and our law is a little bit different than theirs, like we said. One important thing is that in Maryland and in the federal law, there are no purchase, use, or possession crimes anymore. So a person is not going to be penalized for having the tobacco product, regardless of whether they are under the age of 21. Like Dr. K said, it's the onus is on the retailer or the licensee not to sell that product. They're the one who are going to be fined civilly or possibly in some cases criminally. The other thing I wanted to say was, sorry, I lost my train of thought. The other thing that I wanted to say was that this law does not support service members. Actually, the Surgeons General of the Air Force, the Army, and the Navy have expressed concerns about the high levels of tobacco product use among uniformed service members, saying that it's a threat to the health and fitness of our forces and compromises readiness, which is the foundation of a strong national offense. So therefore, bringing our law into parity with federal law, which is the law. Federal law is the law due to federal preemption. So we do need to be following the federal law as it stands. So the fact that that our law is separate from federal law does cause the confusion that you've heard about. So bringing our law into parity with federal law, as well as supporting our service members, is why I request a favorable report on Senate Bill 220. Thank you.
Thank you, Ms. Innes. Do I have any questions for this witness? I don't see any. Thank you very much.
Thank you.
So that ends the hearing on Senate Bill 220, and we're going to now go to Senate Bill 222. And Dr. K, you have a sponsor panel. You have Matt Coomers, Clifford Mitchell, and I think just those two. Your
Yes.
sponsors, so they can come up to the table, please. You can begin. Thank you.
Thank you for this opportunity to speak on behalf of MDH's support of Senate Bill 222. This bill addresses a part of the public health workforce that is less understood, less discussed, and less known, our environmental health workforce. These are the trained professionals who ensure we have safe food and water, make sure our waste disposal systems are working, and protect Marylanders from environmental health hazards across the state. Maryland has lacked training programs for environmental health specialists for decades. You and this committee are fully aware of how the lack of qualified staff in the local health departments has hampered businesses and development across the state through long waits for well and septic permits and for food service inspections. To address this shortage, MDH and the State Board of Environmental Health Specialists are working to create an apprenticeship program to train and teach interested Marylanders in the science and art of being an environmental health specialist. This bill is a critical part of that process and will ensure that those who complete this apprenticeship meet the high bar required to qualify for licensing examination. I believe this bill will bolster a critically important workforce in an innovative fashion that is consistent with Governor Moore's efforts to strengthen the overall workforce in our state, and I encourage a favorable report from this committee. Thank you.
Thank you, Dr. K. Next we have Clifford Mitchell.
Thank you, Chair Beidle. Vice Chair Klausmeier. Me too.
We like that testimony. And then finally, we have Matt Coomers.
Hi, good afternoon, Madam Chair, Madam Vice Chair, distinguished members of the committee. My name is Matt Cummers, and I am the board chair for the Board of Environmental Health Specialists. Again, I would like to say that we really support this for a lot of many reasons you probably heard before. One of them, there's three main tenets of the bill. One of them is apprenticeship. The other one is quorum, which helps us do business in a more efficient way. And the other one is the examination. So all of these are definitely beneficial and necessary for, our streamlined process so we can license these professionals to practice while they're actually learning at the same time. We urge a favorable report. Thank you very much.
Thank you for that testimony. Do I have any questions for this panel? I have one more witness, but no questions for this panel. Thank you very much. And next we have Sarah Sample, who's going to testify in favor.
Hello, thank you to the chair. Thank you to members of the committee for having me today. I'm Sarah Sample on behalf of MACO, and I'm pretty much going to say an absolute me too as well. And we also have written testimony from Don Curtin, who is the president of the Environmental Health Directors Conference, which is also in support of this bill. Our professionals tell us this would be a massive help for pipelining individuals into this workforce. So we support a favorable review.
Thank you very much.
Thank you.
Are there any other questions? That will end the hearing on Senate Bill 222. Next, we're going to hear Senate Bill 246. We have, again, Dr. K. And you have one more person on your panel, Peter DiMartino.
Correct.
Thank you.
So thank you for the opportunity to speak on behalf of Senate Bill 246. This is a critical piece of legislation. Since the beginning of the AIDS crisis in the 80s, Maryland has led the nation in responding to evolving needs in this area of meeting people where they are and getting them care and treatment they need. Today, 70% of the new HIV diagnoses are in Black individuals, about 17% in Hispanic individuals. This bill is another tool in our arsenal to be able to end the HIV epidemic and advance health equity. So this bill would allow the prescribing of non-occupational post-exposure HIV prophylaxis, which is NPEP, which is the use of medications to treat somebody after a single high-risk event to prevent HIV seroconversion. NPEP, in order to be useful, has to be given immediately within 72 hours, and the sooner the better. This bill would establish the NPEP standing order program to be administered by the department, and it would allow pharmacists, through a standing order, to provide that medication, the NPEP, which will increase access to care. It's another route. People can go to urgent care centers or to emergency departments, but there are delays there and there are access issues there. This is another tool. As part of the program, the department will provide direct field services to address the follow-up, adherence monitoring, and care engagement needed of program participants who get their medication at a pharmacy. But by enabling pharmacists to dispense NPEP without a prior prescription, we can mobilize additional frontline providers, like we did during the COVID response with pharmacists in our fight against HIV. I ask this committee for a favorable report, and thank you for the opportunity.
Thank you, Dr. K. And Mr. DiMartino, would you like to go?
Thank you so much for the opportunity to speak. I'm the Director of the Infectious Disease Prevention and Health Services Bureau with the Maryland Department of Health. And we very much support this program and are looking for a favorable review and look forward to working with the community to implement this.
Do I have any questions for this panel? No. Thank you very much. Next, we have Matthew Levy from Prince George's County Health Department. Favorable. Thank you.
Good afternoon, Chairman Beadle, members of the Finance Committee. Thank you for the opportunity to provide testimony today. I'm here to express strong support for Senate Bill 246 on behalf of Prince George's County Executive Ms. Angela Alsobrooks and the Maryland Association of County Health Officers. A vote for Senate Bill 246 is a vote to reduce HIV cases and disparities in Maryland. This is especially important to me as the health officer for Prince George's County, which was recently named by the federal government as one of the 57 areas in the country where HIV transmission occurs most frequently. HIV NPEP is highly effective in preventing HIV infection if it is administered within 72 hours of potential exposure. In fact, NPEP is more effective the sooner it is administered following exposure. I'd like you to think for a minute about the last time you tried to schedule a doctor's appointment. Now imagine you had to schedule the appointment, attend the appointment, and go to the pharmacy to pick up your medications all within 3 days. As a physician, I know this is nearly impossible, especially for populations who face greater barriers to access, like many of the residents in my county. Community pharmacists, however, are highly accessible. In fact, 90% of the US population lives within 5 minutes of a pharmacy. With extended hours and convenient locations, pharmacies are well positioned to administer NPEP. Prince George's County appreciates that Senate Bill 246 includes requirements for pharmacists to notify the patient's primary care provider after dispensing NPEP. If the patient does not have a primary care provider, the pharmacist must provide a list of primary care providers and clinics for follow-up. This will help ensure quality and continuity of care for the patients. We commend the Maryland Department of Health for their work on this critically important legislation and urge a favorable review. Thank you for the opportunity to testify and for the work you do daily to improve the lives of Maryland residents. Thank you.
Thank you very much. If I have no questions for this favorable panel, we thank you very much for your testimony. Next, I'm going to bring up Laura Jessic, favorable with amendment, and Jane Cranky, favorable with amendment. And Elia Horton, also favorable with amendment. Oh, I'm sorry, she's virtual. I'm sorry.
Hi. Hi, good afternoon, Chair Beidel, Madam Vice Chair, and members of the committee. My name is Jane Krinke. I'm here on behalf of the Maryland Hospital Association and our 62 member hospitals and health systems. We are in very strong support of Senate Bill 246 with a friendly amendment. Back in 2022, the General Assembly passed legislation to create a program, an NPEP program, to provide free access to HIV prophylaxis for survivors of sexual assault and child sexual abuse. And our goal with the amendment is just to acknowledge the program exists and ensure that there's no barriers, that hospital pharmacists can continue to participate and that patients aren't billed in error. But otherwise, we think the program could advance open access to survivors that really need it. We just want to ensure that nothing compromises the existing state program. And I've included an amendment in our testimony. And with that, we ask for a favorable report on Senate Bill 246. Thank you.
Thank you, Jane. And I'm looking. Laura, please.
Yes. Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. I'm Laura Jessic. I'm the Sexual Assault Kit Initiative and Response Team Manager with the Maryland Coalition Against Sexual Assault, and I'm here at the invitation of our director, Lisa Jordan. MCASA is the coalition of rape crisis centers across the state of Maryland, and our office includes the Sexual Assault Legal Institute, where we provide direct representation to survivors of sexual assault in Maryland. We're here in support of Senate Bill 246 with amendments that acknowledge the existing program for preventing HIV infection for rape victims and allows providers to continue utilizing this program for sexual assault and rape survivors. For sexual assault survivors, contraction of HIV is a major concern. In fact, 91.9% of rape survivors reported fear and concern for contracting HIV. In response to this, the program for preventing HIV infection for rape victims was created. This program, which is administered by the Governor's Office of Crime Prevention and Policy, Sexual Assault Reimbursement Unit, resulted in the creation of a streamlined process for prescribing sexual assault survivors with NPEP medication that ensures access in a timely manner by providing medication at discharge or arranging through courier services from a mail order pharmacy contracted with the state. So to conclude, MCASA supports SB 246 with amendments that allow qualified healthcare providers to continue utilizing the already established program for preventing HIV infection for rape victims, which, according to data provided by the Sexual Assault Reimbursement Unit, has provided 505 survivors with this medication between October 1st, 2019 and September 30th, 2022. We look forward to continuing to work with the Maryland Department of Health and the Maryland Hospital Association on this important issue. So we request a favorable report on SB 246 with amendments. Thank you.
Thank you for your testimony. Do I have any questions for this panel? Thank you very much.
Thank you.
I have one unfavorable. Pam Casemeyer, please come to the table.
Hi, Madam Chair and Madam Vice Chair, and members of the committee. This is not an easy bill to oppose. And actually, I'm here on behalf of both the Academy of Pediatrics and MedChi to raise concerns. And I want to start out by saying I could use up almost my 2 minutes saying how much they understand the objective of this bill and how much they want to work with people to make sure there's rapid access. They felt that it would be less than candid to not share with you some concerns they have about the way this is going to be administered. And largely it has to do with MPEP. It's analogous to Narcan, but it's not analogous to Narcan because some individuals, even if they've been exposed, the MPEP medications are contraindicated. Depends on what medications you're already on. Some of those medications have caused kidney and liver failure in some. There's lab testing that's done. There's follow-up and counseling that's done. So from the physician community, they're a bit concerned about sort of walk in and get it standing order. I know that the bill has language in it and we'll work with everyone on this because it is a critical issue to get access to this medication, but you don't want to have unintended consequences such as I can go in, I got it from the pharmacy. I know the pharmacy is supposed to say, go see a primary care provider or see yours, but they won't necessarily be the one that tracks them for follow-up. And the person says, oh, I got my medication and it's a month worth. It's not one time. They take it for a month. So I'm fine. And then 2 months later, they're like, oh, I better go get some more. So there's a lot of framework and a lot of issues relative to the medication and effectively being sure we're doing what we're wanting and we're not creating unintended consequences. So we felt like it wasn't fair to not express those concerns as we're working through this issue.
Thank you, Ms. Casemeyer. Do I have any questions? Looks like we have a little work to do. Okay, so thank you. And finally, we have one more favorable with amendment virtually. So Ms. Horton.
Hi, good afternoon. My name is Aaliyah Horton. I am the Executive Director of the Maryland Pharmacists Association, and we are in support of this bill, SB 246. We do have some questions or concerns, but I think for the most part, those can be addressed in subcommittee discussion. But I do want to say that this bill is one that creates an entry point, not an end point, for patients seeking NPEP. It's an opportunity for creating access. And in Maryland, and I know that many of people testified with a lot of the stats, but Maryland is ranked 12th among states and territories in adult and adolescent HIV diagnosis rates in 2021. And the Department of Health shows the highest rates are seen in Prince George's County and Baltimore City, and also in rural counties in Western Maryland, Eastern Shore, and Southern Maryland. And all of these areas have, particularly in the rural communities, have limited access to primary care providers who can provide prescriptions for NPEP. So this creates a tremendous access point. I also included, one of the things that I wanted to mention with the previous person that provided testimony mentioned concerns about counterindications. The bill requires that pharmacists screen, and there is a process for the screening that looks at whether the patient meets the clinical criteria, as well as part of the screening includes review of medication and whether the medication can be initiated in the designated time frame. And then I also just wanted to mention that included in my written testimony is a report called The Role of Community Pharmacies in Providing Access to HIV Post-Exposure Prophylaxis, PEP. And so it specifically talks about this one medication and the role of pharmacists and details quite a bit of information on the importance. And I will leave it at that. Thank you.
Thank you for including that information with your testimony. A couple of people, including you, have said favorable with amendment or mentioned amendment. If you have an amendment, we'd really like to have that in the committee. So
Yes, we're working. to clarify how we want to phrase, and I think a lot of it can come from conversation, but it's regarding some of the educational provisions, testing, the administration of the program, and some of the administrative requirements, just clarification on how it's going to run, I think would be really helpful for us. So I don't know if amendments would be required or not. So just wanted to have those conversations.
Thank you very much. Do I have any questions for this virtual witness? Thank you very much. Always a pleasure to see you. Thank you. That ends the hearing on Senate Bill 246, and now we're going to hear Senate Bill 212. And let's see where we start. Number one, okay. Alicia Lord, and do you have a sponsor panel with you, or just?
I do not.
Okay, thank you very much. You can start.
Chairwoman Beidel, Vice Chairwoman Kastmeyer, and members of the Finance Committee. For the record, my name is Alyssa Lord, and I serve as the Deputy Secretary for Behavioral Health at the Maryland Department of Health. Thank you for the opportunity to testify today on this important departmental legislation, Senate Bill 212, which is aimed at aligning the work of the federally mandated Behavioral Health Advisory Committee with the work of the legislatively mandated Commission on Behavioral Health Treatment and Access. This bill would also require the Commission to conduct a critical study on behavioral health financing and report back findings on January 1st, 2025. Last session, the General Assembly passed legislation establishing the commission. Once appointments were made, the commission quickly got to work and had work group meetings. The commission had completed an initial report to the legislature. 11 departmental employees provided day-to-day staff for the commission, and the commission also has the commitment of leadership dedicated to its work. In parallel, federal law requires the department to maintain a behavioral health advisory committee or council. This council is required in order to receive block grant funding from the federal, from SAMHSA, the Substance Use and Mental Health Services Administration. The goal of this legislation is to streamline efforts in order to maximize the effectiveness of stakeholder input. Many members of the council also sit on the committee. This bill would allow for joint meetings and reporting. The bill also extends commission reporting deadlines to reflect when the commission was able to start meeting. The bill also requires the commission to research and make recommendations to the governor and General Assembly regarding integrating behavioral health services into Maryland's Medicaid program. Maryland currently separates or carves out Medicaid financing of behavioral health services from its Medicaid managed care organization. This carve-out, established in 1997 for mental health services, aligned with a national trend at the time that saw carving out for behavioral health services as a promising approach, protecting funding for behavioral health, establishing specialty provider networks who could provide specialty behavioral health services, and mitigating insurance plans from limiting their behavioral health benefits. In recent years, there has been growing national discussion and shifts to carve in and integrate behavioral health to Medicaid MCO financing. A key driver of this trend is that evidence has shown that strategies to enhance clinical integration of behavioral health and physical health can improve patient outcomes. Studies have shown that carve-in states outperform carve-out states by a wide margin, saving Medicaid $2.06 billion in state and federal expenditures, with notable changes including an overall decrease of 6% in Medicaid costs per prescriptions and a 14% lower net cost for the MCO paid prescriptions than the average in the fee-for-service states. Similarly, a study done by the National Institutes of Health found that the financial integration of physical and behavioral health and Medicaid managed care was associated with greater access of behavioral health services, particularly for individuals with mild or moderate mental health conditions, and for Black enrollees, which can help advance the fight for health equity. The current carve-out and separate financing of care may inhibit reimbursement for services, create challenges in referring patients from primary care to behavioral health specialists, and impede communications, which altogether can have a detrimental impact on patient health outcomes. Given the potential benefits and risks, it is important that Maryland assess next steps on behavioral health integration through research and stakeholder engagement. The recently established Commission on Behavioral Health Care Treatment and Access is tasked with reviewing research and making recommendations to guide the state on providing appropriate, accessible, and comprehensive behavioral health services. Adding the task of researching and making recommendations on integrating behavioral health services is an important next step to determine whether this is the right step for Maryland. I ask this committee for a favorable report. Thank you for your consideration. I'm happy to answer any questions.
Thank you very much. Do I have any questions for Ms. Lord? Senator Hershey, please.
Thank you, Madam Chair. Thank you. You mentioned obviously there's been a big concern here in the General Assembly about the carving in of behavioral health services into the Medicaid MCOs. In fact, in 2004, we did pass legislation that would expressly prohibit the health secretary from ending the carve out. And now in 2015, 2019, again, we kind of reiterated that from the General Assembly's perspective, as we did not move forward with anything that would have required that. But you had mentioned in part of the bill, pages 8 or 7 and 8, express or talk about the recommendations that we might see from this commission. So I think I'd like to know, or at least maybe some of my colleagues would as well too, given this contentious history about this specific issue, do you think MDH plans to come back to the General Assembly for approval? Should the Integration Commission recommend involving a behavioral health carve-in?
The ask as part of this legislation is to complete the study, right? As part of the charge of the commission, we are tasked with making recommendations around service provision, reimbursement, best practices across other states, and that will allow us to inform what future recommendations will be. So
you don't think that so you're not saying there's any preconceived position from the Department of Health on where they want to go with this?
we are asking to conduct a study to further understand what is happening at the national landscape and the potential impact for service provision in the state of Maryland.
Okay. Just recently, CMS came out with a new model to integrate behavioral health, right, with somatic care, and they're calling it the Innovation in Behavioral Health model. Is that right?
Yes, that's correct.
Which also seems to be very much what you're talking about here as well, too. Does Department of Health plan to apply to be one of the 8 states that can implement the IBH model?
We are currently exploring that opportunity.
Exploring it. So
that's correct.
It
was just released, and so we're waiting additional details for the notice of funding to be released to the public.
Again, if we've seen 8 states do that, would Department of Health be against us maybe adding language to direct Department of Health to do that?
I think I can certainly take that back as to whether that's something that we would consider, but we are exploring the opportunity.
Okay, great. Okay, thank you very much. Thank you, Madam Chair.
Thank you, Senator Hershey. I have no other questions. I'm going to ask for Allison Taylor, favorable, to come to the table.
Good afternoon, Madam Chair and members of the committee. I'm sorry. Hi, good afternoon, Madam Chair, members of the committee. My name is Allison Taylor, here from Kaiser Permanente. Kaiser supports integration, and so from that perspective, we appreciate the language in this bill about the study. But Kaiser also supports the efforts to streamline the work groups that the department is required to manage. So we urge a favorable report.
Do I have any questions for Ms. Taylor? Thank you very much. Nice to see you again. Now I have 3 people that are favorable with amendments. They can come up at one time. Lori Doyle, Dan Martin, and Ellen Weber, please. Ms. Lord, you don't need to stay at the table. Thank you. Sometimes there's a little more opposition, but I want to be careful.
Shows who the newbie is, right? So
thank you.
Thank you, Madam Chair. Lori Doyle here on behalf of the Community Behavioral Health Association of Maryland in support of the bill with amendments. We agree with integration. We think it's a great idea. We've been coming to you with ideas to do just that. There's more than one way to achieve integration, and we thank the committee for your past support in passing some of that legislation. But while we support integration, we do not support a carve-in of behavioral health services into managed care. This has been, as Senator Hershey suggested, a long and contentious discussion. And so you all passed actually in 2019, there was a carve-in bill that was withdrawn in both houses after it had such a contentious hearing in HGO. The bill was withdrawn. And as Senator Hershey suggested, you all passed language that said that the department can't carve in mental health without getting explicit permission from the General Assembly. The good news is that we do have a way to integrate care without at least conducting this carve-in, carve-out discussion right away, and that's through the IBH model. It's the Innovation in Behavioral Health. It's brand new. CMS just came out with it, and it will do exactly what we're trying to get. It's an 8-year model. 8 states will be chosen, and it allows it requires the feds to support technical assistance and funding to provide integration of somatic and behavioral health. So we think that this is a good way to go. And so in terms of our amendments, we suggest 2 things. One, that we change the date for the recommendation in the bill from January 1 of 2025 to July 1 of 2025. That'll give the commission a year. This is a very complicated issue. 6 months would not be enough to do this. And then secondly, we suggest that you consider language directing the department to apply for this IBH model. It is certainly congruent with what we're trying to do here, and we'd hate to be left behind when only 8 states are going to have this opportunity. So thank you for your time.
Thank you, Ms. Doyle. Dan Martin.
Thank you, Madam Chair, members of the committee. Dan Martin with the Mental Health Association of Maryland. Happy to be in front of finance for the first time this year. I look forward to working with you all this session. We're here in support of Senate Bill 212 with an amendment. The Mental Health Association of Maryland is very in support of integrating mental health and behavioral health and somatic care. And we applaud this committee for really helping to spearhead the package of bills last session that's doing just that, integrating behavioral health and somatic care at the clinical level in primary care practices and community behavioral health clinics. But the devil really is in the details with this issue. The public behavioral health system in Maryland serves around 300,000 children and youth with mental health and substance use disorders. So any kind of clinical reforms really need to be done with an eye towards not disrupting care for those individuals, and also with an eye towards preserving the really great parts of Maryland's public behavioral health system that have made it one of the best in the nation. In addition to the Medicaid population, Maryland's system covers uninsured and underinsured individuals, Marylanders 65 and older, and those who are dually insured by Medicare and Medicaid. It provides a single point of contact and processes for community behavioral health providers, streamlining administration so they can focus more on delivering care. And it has strong local management component to address different needs in different communities. And so we need to make sure that, again, we're having an eye towards preserving all of these positive things before we do any kind of big system reforms. And so, again, given that level of complexity, we want to make sure the commission has time to consider all these different options and different considerations that they need to consider when doing the study. So we would also request an amendment pushing the reporting date back 6 months to July 1st, 2025. And with that, I will stop and say thank you very much.
Thank you, Mr. Martin. And Ellen Weber.
Thank you, Chair Beidle, Vice Chair of Klausmeyer, members of the committee. I'm Ellen Weber. I'm here on behalf of the Legal Action Center to support 212 with amendments. We convene the Maryland Parity Coalition in Maryland, and the coalition's efforts are to ensure equitable access to mental health and substance use disorder care in public and private insurance. We support SB 212 with an amendment that would require the commission in issuing its recommendations to ensure compliance with the Mental Health Parity and Addiction Equity Act. We're working with Senator Lamb, who is developing an amendment, and that language is in our testimony. Compliance with the Parity Act is foundational for any financing system, whether it's a carve-in or carve-out. Non-discrimination standards must be baked in to the structure of our financing and delivery system, not evaluated on the back end. The Maryland Health Department is required under federal law to ensure compliance with the Parity Act regardless of the financing system, and state law also requires the Medicaid program to comply with the Parity Act, specifically with regard to scope of benefits, billing limitations, and reimbursement rates. This is under Health General 15-103.6. In each of these areas, the Maryland Department of Health must ensure that the standards that apply to mental health and substance use disorder benefits are comparable to and no more restrictive than the standards for medical services. The Parity Act is also at the heart of quality oversight. It applies to whether people get access to care or not because of network adequacy, billing requirements, as well as benefit coverage. We believe it is vitally important to reinforce the department's obligations under SB 212. The department has failed over the past years to demonstrate that Maryland's Medicaid program complies with the Parity Act. It has never conducted an assessment of whether our reimbursement rates comply with parity. Over the past 4 years, regulators have identified compliance problems, and just in 2023, it addressed billing limitations that stakeholders have raised. We thank you for your consideration. We hope that this amendment can be adopted so that this analysis is built in on the front end. Thank you very
Thank
much.
you. Do I have any questions for this panel? Thank you all very much. We're going to go to our virtual witnesses. First, we have favorable from Ashley Toller. Ashley.
Good afternoon, Madam Chair and committee. My name is Ashley Toller. I am the Policy and Advocacy Associate with Maryland Coalition of Families. And we are testifying in support of Senate Bill 212, ensuring that family voice is heard at all tables. And that is all. Thank you for the opportunity for letting me testify today.
Thank you. And finally, we have Irene Day, and she is favorable with amendment.
Hi, good afternoon, Madam Chair, distinguished members, ladies and gentlemen of the committee. Thank you for the opportunity to present to you today. My name is Irene Day. I'm an Assistant State's Attorney in Baltimore City State's Attorney's Office, and I'm here today representing the Maryland State's Attorneys Association. I am currently the Division Chief for our District Court Mental Health Court Unit. I'm here to testify in favor of the bill, but requesting an amendment to include a representative from the Maryland State's Attorneys Association to be included in the commission. The bill lays out recommendations are to be made for expanding behavioral health treatment for the state's court-ordered population. It indicates that there need to be assessments regarding the state's forensic population. And there's a specific commission establishing the following work group of a criminal justice involved behavioral health. And while many of our stakeholder partners are at the table, the state's attorneys across the state are not included in this commission. And we would request to have representation at the table so that there's balanced representation of the criminal justice stakeholders on the commission. Thank you.
Thank you. Do I have any questions for Ms. Day? Thank you very much for your testimony. Thank you. That ends the hearing on Senate Bill 212. Next, we're going to go to Senate Bill 241, and Ms. Grant is here with us from the State Board of Examiners of Psychologists. I think. Thank you, Ms. Grant. Who do you have with you?
I'll let Lorraine introduce herself.
Hi, I'm Lorraine Smith, the Executive Director of the Maryland Board of Psychologists.
Good afternoon. My name is Samantha Ruckert. I'm a current member of the Maryland Board of Psychologists.
Okay. So we're going to start with Ms. Grant because you're favorable, and these two witnesses are favorable with amendments.
Okay, sounds good.
Ms.
Thanks
Grant,
so
go
much,
forward. Thank you.
Chair Vital, committee members, Marie Grant on behalf of the Maryland Department of Health. It's great to see you all again. I will repeat my testimony that you've heard from me over the past couple of weeks on a number of health occupations bills. We're asking for a 3-year sunset extension. This is a uniform position we're taking across all of our health occupations boards that are up for renewal this year, and would be happy to address any questions you have. Thank you.
Samantha and Lorraine, please.
Yes, thank you very much. Again, my name is Lorraine Smith, and I'm the Executive Director of the Board of Psychologists. As you know, today more than ever, mental health services are essential and necessary. Therefore, we need and we must make sure that we maintain qualified psychologists, and psychologists must have different skill sets to accommodate the various mental health needs of the public. Licensed psychologists serve people of all ages and nationalities in Maryland. The board works to help prevent exploitation and harm to Marylanders by licensing those who meet specific qualifications, establishing standards of practice, receiving and resolving complaints from consumers and the public, and correcting the behavior of providers who violate the standards of practice. The board has consistently improved its work processes and provides online services. We require background checks. The board has increased the number of mental health providers by registering master level psychologists. Over the years, the boards has consistently adhered to and excelled in the legislative mandate to protect the public. The board is grateful for the recommendation to extend the board for 3 years as recommended in Senate Bill 241, and will happily accept it. The board asks that you consider extending the board for 10 years to ensure the continuation of the board for many years to come, to carry out its mandate to protect the citizens of Maryland and provide quality mental health services. Thank you for your time and your consideration.
Thank you. And our last witness.
Good afternoon, Madam Chairperson and members of the committee. My name is Samantha Ruckert. I am a psychologist in Maryland and a current member of the Board of Examiners of Psychologists. I'm testifying in support of Senate Bill 241 with one amendment. You should have received our position paper, and you've just heard from our Executive Director, Ms. Smith. The board's mission, once again, is to serve and protect the public and ensure that consumers in Maryland can access and receive high-quality psychological services. Belief in and commitment to this mission was my primary motivation for joining the board in 2020. Over the last 4 years, as you know, we've had unprecedented challenges like the COVID pandemic and everything that it brought with it. These challenges have affected, but have not disrupted or diminished the work of the board, something that I'm very proud of. The board appreciates the recommendation to extend the statutory and regulatory authority until 2028, but respectfully asks the committee to amend this legislation to extend the board by the customary 10 years to 2035. This will allow the board to focus on its vital functions as mental health services are expected to remain in high demand. The board appreciates your time and consideration and asks that you vote in favor of this bill with the aforementioned amendment. Thank you.
Thank you very much. Do I have any questions for this panel? Thank you very much. That ends the hearing on Senate Bill 241. Thank you. And Ms. Grant, we're now going to start Senate Bill 242. And I think you have Susan Kopich with you on your panel. Thank you.
Thanks so much. Thank you, Chair Vital, Vice Chair Klossmeyer, committee members, Marie Grant on behalf of the Maryland Department of Health, here in support of this legislation, again recommending a 3-year sunset extension to align with the position on other health occupations boards, and we urge a favorable report. Thank you.
Thank you. Susan?
Good afternoon, Madam Chair and Madam Vice Chair and the committee. I am the chair of the Maryland Board of Social Work Examiners. I'm recovering from a brain injury, so I've written my testimony. And I just like to read it to ensure that all my words that I say them all. The Board of Social Work Examiners is the regulating authority for social work in the state of Maryland. Regulation is important to the profession and to the public. Regulation helps ensure those that are practicing are qualified and competent. Without licensing, there is no standard for quality assurance. The social work profession is an important provider of mental health care. Social work regulation helps protect those that are not able to protect themselves. People seeking mental health care are usually in a vulnerable state. They need credentialing as a reliable source of information about individual practitioners. Thank you for considering this testimony for SB 242. We ask for a favorable vote. I'm here to answer any questions.
Thank you. You did a very nice job.
Thank you.
Hope you
That was my
continue to
first time testifying since the accident.
Well, I hope you continue to recover.
Thank you.
Do I have any questions for this panel?
Yes.
Oh, Senator Reedy, I'm sorry.
Thank you, Madam Chair, and I appreciate, thank you for testifying. I have a question, and Marie, either one of you could answer, but we've had some constituents that have reached out about with concerns, and we've even heard from some other senator members, concerns about someone's being investigated for wrongdoing, and that it just kind of stays and sits for a long time, and they can't get an answer, and so the agency that's working with them or they can't really move forward because there seems to be a long lag. And it's not unique, I'm sure, to this board, but this board's been mentioned by some folks. Can either one of you speak to what we can do to try to be sure we're getting back in a timely fashion? And by timely, I don't mean 2 weeks, but also so if stuff's lingering for months, it causes a problem and we're short-staffed in this area. So I don't know if you could speak to that.
Do you mind if I speak
Go
to it
ahead.
first and then, would defer to you as chair of the specific board, just to talk generally, Senator Reedy? I think there has been a couple of cases, including one that's come across my desk recently. I think sometimes the challenge and frustrating for all of us, including myself, sometimes investigations take time and they are confidential, right? So there really is, and it really depends on the nature of the investigation, and we don't always have insight into what's going on in particular. I will say generally that certainly the Secretary of Health is keenly interested in making sure that the boards are appropriately resourced and are able to conduct these investigations into a timely manner. But I do think sometimes there is a challenge just given the individual specifics of a particular case. So
Are there things that we could, and I'm happy to hear your answer also, but are there things that I know the answer is always more resources, but it just figuring out if there can be a way so that the person who's being investigated or the people that they work for can know that there's we're at this point in the process, not what's happened in the investigation, but just we're still ongoing. I mean, is that conducted where if I'm being investigated, I can inquire as to where we are in the process? Maybe you could, if you'd like to answer.
Yes, I think that is something that the person being investigated can ask those questions and should get answers.
If they don't, do they just need to appeal to, I guess, to the head of the board?
The executive director of the board. And for the Board of Social Work Examiners, we just have a new executive director coming on the 7th of February, very soon. But we have been without the executive director for quite a while now, and we have also had a couple vacancies in our investigators. So
that's possibly part of why there's been okay.
I definitely would like to think that we have a brighter future coming in terms of that.
Okay, thank you very much. And best of luck to you. I'm glad you're on the mend. Yeah.
If there are no other questions, this will end the hearing on Senate Bill 242. And now we're going to go to Senate Bill 218, which is Physicians and Allied Health Professions. And Ms. Grant, you're back up again. And I think you have Madeline Del Greco and Matthew Duzick with you.
And thank you, Madam Chair, and defer to my colleagues at the Board of Physicians to get started, if that's okay with you.
Thank you. That's fine. Thank you.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Madeline Del Greco. I'm a health policy analyst with the Maryland Board of Physicians. The Maryland Board of Physicians is in support of Senate Bill 218, Physicians and Allied Health Professions, Reorganization and Revisions. First, I would like to note that we are aware of some minor typographical errors that will require amendment to correct, but we have no substantial amendments. You have my written testimony where I go into detail about how this bill stems from the Board of Physicians 2020 Sunset Report recommendations. So for the sake of time, I won't touch on that now. However, it is important to note that Senate Bill 218 makes no substantial change to statute, will not alter current board practices, nor will it change licensure requirements for any practitioner regulated by the board. Rather, it is only a restructuring bill that streamlines and cleans up the Maryland Medical Practice Act. As the Maryland Medical Practice Act is currently organized, all health occupations have some requirements that are consistent, and those requirements are repeated in each health occupation section. So this includes stuff like the criminal history records check requirement and change of address notification requirement. This bill would move those common provisions to one centralized general provision section. In addition, Senate Bill 218 standardizes terms and eliminates redundant or outdated language throughout the act. The Maryland Board of Physicians anticipates that this bill will make a significant positive impact on the accessibility for board staff, regulated health practitioners, and legislators alike to navigate the Maryland Medical Practice Act. And we are in support of moving Senate Bill 218 forward. Thank you for your consideration.
Good afternoon, Madam Chair, members of the committee. Matt Dudzik, Manager of Policy and Legislation at the Maryland Board of Physicians. I really don't have anything to add to Maddie's testimony, just here to answer any questions, and thank you for your time.
Thank you. And Ms. Grant, do you have anything you'd like to add?
Just thanks, Madam Chair, Madam Vice Chair, committee members. Just wanted to express the department's support for this legislation as well. This is something, it's been an effort by the Board of Physicians over several years. They put a lot of thought and a lot of work and effort into making a recommendation for you all that I think will gain clarity into their statute. And so we would just urge a favorable report with the technical amendments that these folks will offer.
And you've submitted those technical amendments?
We have not submitted them yet.
These amendments were brought up by the council to HGO, and she just noticed some typographical errors. So she's actually writing those up as amendments, and she's gone over them with us. They all make sense to us, but once we have them formalized, we'll submit them here as well.
Thank you very much. And then I have one unfavorable, so you can leave the panel if you like.
Thank you.
Thank you. Deborah Bricado, unfavorable testimony.
Good afternoon, Madam Chair, Madam Vice Chair, and Senators. I'm Deborah Bricado from Maryland Right to Life, and we do oppose Senate Bill 218. We see that ending a human pregnancy or abortion is explicitly included in this bill, so obviously other portions of the bill would apply to abortion. And we do oppose the further funding of abortion training, which we can see that with the appropriations allowed by the collecting of fees by the State Board of Physicians, that these fees could be used to apply to the Maryland Loan Assistance Repayment Program. Now, the Abortion Care Access Act already provided a $3.5 million training fund for abortion training. So we do oppose the further funding of abortion training. We also look at the liability shield and the saying that there are certain records that would not be admissible in evidence in any proceeding. We feel this is not good for patients who may be injured or even killed by bad medical practice. We also look at the loosening of license renewal, and it shows that they may not even have to enforce license renewal if they feel reduce the number of healthcare professionals in certain areas. We do not see how that helps these poor communities if license renewal restrictions are loosened, because we want to see the best medical practice for anyone, whether they live in a poor community or not. So for all these reasons, we do ask for an unfavorable report on Senate Bill 218. Thank you.
Thank you, Ms. Bricado. Do I have any questions for this witness? Thank you very much. That ends the testimony on Senate Bill 218. Next, we have Senate Bill 221, Health Occupation Boards, and Matthew Dudzik and Karen Katrinik.
Good afternoon, Madam Chair, Madam Vice Chair, and committee members. Thank you so much for the opportunity to speak. My name is Karen Katrinik. I am on the Board of Professional Counselors and Therapists. I'm a licensed marriage and family therapist, and I'm also the head of the Legislation and Regulation Committee. We are here today to support 221 with the amendments that are in the bill, which are really don't change the substance of the bill. It's really just to take out that one word jurisdiction. So we want to share that like since COVID, there's been, what's the word? A lack of not enough care for mental health people. And all of the colleagues that I know, we all think everybody's waiting to find a therapist. So this bill started out with our former chair, Nikki Drotliff, was doing just MFT reciprocity. And then it ended up all 5 licensees that our board takes care of. And then the AG's office saw it and said, why don't we open up to all the all health occupation boards that so would want to have reciprocity. So this allows people to practice who are licensed professionals in one state to ask for without having to go through the big old when you have to apply for a license in another state, it can take almost like 6 months to a year. This would be if the other state has the same qualifications, the same training, the same level of skill. This automatically would allow the clinician to work and be licensed in other states. It also opens up for our residents greater choice of providers, different treatment modalities that might not be available nearby, also rural communities, underserved communities, and minorities there's a gap sometimes for them to get mental health care. And we're thinking that if we open it up and make it reduce the barriers, it will thank you.
Much, Matthew.
Good afternoon, Madam Chair, members of the committee. Once again, Matt Dudzik with the Maryland Board of Physicians. The Board of Physicians is in kind of a unique place among the health occupations boards right now because we actually already have a reciprocity provision built into the Medical Practice Act. As a result of this provision, in March of 2023, we officially entered into a reciprocity agreement for physicians with Virginia and the District of Columbia. So I just wanted to provide the committee with some numbers to demonstrate how effective this program has been. In just the first 9 months of the program, we licensed 236 physicians here in Maryland via reciprocity, 115 from Virginia, 121 from the district. And then on the flip side of that, over 400 Maryland physicians obtained licenses in Virginia and DC through this same program. It's been so successful that the board has been looking to expand the program. This initial reciprocity arrangement was set up as almost a pilot among these 3 boards. We have been looking to expand the program. We are in the process of establishing a similar agreement for physician assistants. Unfortunately, the board's current statutory authority is to enter into reciprocity agreements is limited to the practice of medicine. So that means that despite the program's success, we have no ability to create similar programs for any of the 11 other health occupations that we regulate. And that includes very vital members of the healthcare workforce. We're talking respiratory therapists, radiographers, a number of other essential practitioners. So Senate Bill 221 would allow the board to explore the development of reciprocity agreements for all of its healthcare practitioners, improving portability of licensure and creating a real impact on the healthcare workforce. Thank you for your time, and I urge the committee to submit a favorable report.
Thank you for that testimony. And I have a question from Vice Chair Klassmeyer.
Thank you, Matthew. So instead of having to work through the compacts, this is a different way to get to what we need. Is that correct?
That's correct. The Board of Physicians is committed to creating multiple pathways to licensure. The compact is one pathway, but this reciprocity arrangement is an even more expedited way. It has lower costs because it removes the burden of credentialing from the physician. Part of the reciprocity arrangement says that we are essentially using the fact that they are licensed in DC or Virginia and they have substantively similar standards to substitute for that whole credentialing process.
And does it have to be in geographical areas, or can you say, for instance, go to California? Can one of these physicians go to California if we have reciprocity with them?
There is no requirement that it must be a geographically close location. There is a requirement under current law that the requirements for licensure need to be substantively similar, and the reciprocity agreement must be two-way. So in addition to a Maryland licensing individuals from that state, they have to have a similar reciprocal arrangement with our state.
All right, thank you.
I'd like to add that the compact bill is only going to be for people who signed up, states that signed up for a compact, and this bill opens it up to all the states that aren't connected to our compact.
Thank you. I have some questions maybe for Matthew. So we'll do a background check before we would give them a license in Maryland?
Yes, it is still required under law that criminal history record check is part of the license.
And they would be licensed, not just given the privilege to practice, but they'd actually be licensed so our board could discipline them, correct?
That is correct, yes.
Thank you. Thank you for your testimony. Do I have any other questions for this panel? Thank you very much.
Thank you.
Next, we have Allison Taylor favorable, and Dan Daugherty. Is Dan here? Favorable with amendment.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Allison Taylor. I'm here from Kaiser Permanente and strongly support this effort and others to streamline licensure for healthcare professionals. So urge a favorable report. Thank you.
Thank you, Allison. Dan, how are you doing?
Good. Thank you, Madam Chair.
Nice to see you back.
Thank you very much. I'm Dan Daugherty. I'm here on behalf of the Maryland State Dental Association and the Maryland Society of Oral and Maxillofacial Surgeons. And we strongly support reciprocity in Senate Bill 221. Dentistry currently has licensure by credentials, which means dentists coming in who meet the criteria set forth in this bill can get a license, but it's a one-way street. We like the fact that this works both ways. So we support the bill, but in order to get dentistry under it without complications and conflicts within the current statute, there would have to be amendments to section 4-306 of the Health Occupations article, which is the Maryland Dentistry Act. I will be glad to put amendments together, send them to your council. It is not terribly complicated, but it just makes sure that dentistry will be involved in the reciprocity like all the other boards without any conflicts. We do believe this is the appropriate way to open up portals for dentists to move from state to state and to provide the mobility that many dentists want and need.
Thank you for that testimony. Do I have any questions for this panel on Senate Bill 221? I think that ends our hearing on Senate Bill 221. Thank you very much. Next, we have Senate Bill 151, Senator Muse. Thank you, Senator.
Thank you. And I do have one person to come and offer testimony as well.
Can you tell me that person's name?
Yes, Lorenzo. Yes.
Oh, Lorenzo Bellamy.
Yes.
He's signed in. Thank you very much. Lorenzo, you can come to the table if you like. Thank you.
Thank you very much, and good afternoon, Chair Vital and Vice Chair Klausmeier and esteemed members of Finance Committee. I once served on this committee for about 5 or 6 years, about a decade. No, it's a long time ago. This is a bill that passed out of this committee last year, and it would establish a Prince George's County to local bill, a health and wellness work group. And I'm not going to go through the entire bill, but you can see the makeup of the members of this work group. I have offered one friendly amendment, or was offered, that was to add Maryland National Park and Planning Commission as a member of this work group as well. As it relates to health and wellness in our state, I'm sure that a lot of you would agree with me that our focus has always been on disease management. In terms of our healthcare system, it sometimes appears that it's more of a manage sickness rather than heal or prevent in many ways, especially in the Black and brown communities. And many of the diseases that we are managing are related to simply a lack of education and limited options and resources. Therefore, SB 151 would require this work group to review the availability of health and wellness practices in Prince George's County, the available options, number two, the available options for integrative health and wellness programs in the county, and number three, review programs and promote healthy eating within the county's government agencies like schools, et cetera, et cetera. After reviewing these programs, the work group would be tasked with making recommendations regarding the best practices in the health and wellness community, including strategies and programs that, number one, promote healthy eating. We talk about gun violence and violence, how many are killed by violence. Well, a lot of people are losing their lives because of simply bad health choices. Number two, improve equity access to healthy, affordable, and accessible food retailers. Number three, improve access to gyms, rec centers, playgrounds, bike and walking paths, some of the things that can come out of this, and promote healthy eating, physical activity, and healthy habits to prevent obesity. This work group will also make recommendations for incentives that may be provided for employees who promote health and wellness programs. Further, the work group will review, report, and evaluate the benefits and feasibility of integrative health and creating integrative health and wellness hubs in Prince George's County. So this work group would work and they will report their findings December of 2025. In closing, let me also stress the importance of integrated health component of this workshop, or the integrative health component. Integrative medicine combines the most well-researched conventional medicine with the most well-researched evidence-based complementary therapies to achieve the appropriate care of each person. Therefore, incorporating integrative wellness into our healthcare system is vital if we want to compete with the top healthcare systems across the world. Let's look at the Cleveland Clinic, for example, which is ranked as the number 2 top hospitals in the world. Again, for 2023 by Newsweek, World's Best Hospitals list. And this hospital system not only incorporates integrative health and wellness, but they have an entire center that's dedicated to integrative medicine. And so I don't know all the answers, but I do know that we have a health crisis in Prince George's County. Out of 145 certified outpatient dialysis centers in Maryland, our county has 34 of them. That's nearly 1/4 of the dialysis centers. Baltimore City is right behind us with 27%. So the two predominantly Black and brown jurisdictions have 42% of the centers. This is just one example, and there are many more. But I simply know we've got to do something to turn our healthcare crisis around. And I'd like to start with home. They say charity begin at home. You start at home. I'll close with this. The day after Sonny died, had a heart attack. It was a night of Sonny died. We dismissed at midnight, and 3 a.m. I had a heart attack. Well, there were many health choices that I should have and could have made. I lost 8 months of activity in any way. Couldn't work, couldn't do anything. And so for the people, because I love the people that I serve, I even went back to my congregation. I said, we're famous for having chicken dinners, fried chicken dinners and all else. Well, because I love you, we're not going to do that anymore. We're going to promote health within the congregation, because I'm not going to bury someone who prematurely died because we said one thing, our bodies are the temple, but we did something else. And so I would ask us to, I would move and urge a favorable report on this bill for the lives of even our children and many, many others. Thank you very much for your patience.
Senator, thank you for that presentation. I'm glad to see you back and doing so well. You said this passed the Senate last year?
It did, yes.
But it didn't pass the House.
It passed out of the local committee, but it did not get out of the standing committee.
Very good.
Their time ran out in a number of things, right?
A few things. That happened to a few things.
Yes, it did. Yes, it did.
Thank you for this important legislation.
I wasn't going for yes. I would just say yes.
Lorenzo, would you like to testify?
Yes, please. Thank you. Thank you, Madam Chair and Madam Vice Chair and members of the committee. My name is Lorenzo Bellamy of Bellamy Gen Group, and here on behalf of the Prince George's County Council in full support of Senate Bill 151. Senator Muse, thank you very much for introducing this bill again. And as the senator said, it did pass this committee and the Senate last session. Everything that the senator has said about health disparities and holistic and integrative health approaches, I was going to, say the same thing. So I'll just dispense with that and just say that one issue in this bill that just to be aware of, the Prince George's County Health Department does offer health and wellness to the residents of the state, to their county. But so this bill is not intended to usurp or to replace that, but actually to complement and work with the county in its current practices. We think that more needs to be done, and this bill, I think, with this work group will accomplish that. And we're also pleased, as a representative of the council, on behalf of the council, we're glad that the bill includes the chair of the Prince George's County Council to be part of this work group, of course. And so we look forward to working with you and with Senator Muse and members of the House if this bill gets out of the Senate again and we go across the street, looking forward to getting it out of the House as well. So thank you very much, members of the committee. I urge a favorable report.
Thank you both. We'll try to get it out early.
Yes.
Thank you.
Thank
And
you.
We have one more witness favorable with amendment, Jordan Colbert.
Yes, good afternoon, Madam Chair, Madam Vice Chair. My name is Jordan Balcom Colbert. I'm the Government Affairs Liaison in the Office of General Counsel for the Maryland National Capital Park and Planning Commission. Our board has voted to support this bill with the kind-friendly amendments that the senator has proposed today. And we have all submitted written testimony on the record. The Prince George's County Park and Recreations Department is a longtime supporter of health and wellness in the county for our residents. Promoting healthy eating, physical activity, and instilling habits for optimal health has always been our top priority. This friendly amendment that we've engaged the senator to add, which he so kindly has today, would allow us to afford the opportunity to be on the work group to help the Parks Department continue to enhance its health priorities among community residents and alongside other agencies within the county. Again, my name is Jordan Balcom Colbert. Should you have any questions regarding our testimony, please don't hesitate to contact me. Thank you for your time, and thank you, Senator Muse, as well.
Thank you, Jordan. And that ends the hearing on Senate Bill 151. I see no questions, and thank you for your testimony.
Thank you all very much.
And now we're going to go to our last bill of the day, Senate Bill 3, Health Occupation Service Members, Veterans and Military Spouses Temporary Licensure. And Senator Jackson is here. And Senator, is your panel include Lynn Nash and Christopher Arnold?
Yes, Madam Chair, may I bring him up?
You please bring him up. Thank you.
Ms. Nash, and I think Mr. Arnold is virtual.
Probably virtual.
Okay. If he comes into the meeting later, we will add him. Thank you.
Thank you very much. Good afternoon, Madam Chair, Madam Vice Chair. For the record, Senator Michael Jackson, District 27, on behalf of Senate Bill 3. It's a pretty low number. It's a piece of legislation that's been before this committee in the past. It's designed to get qualified individuals to work as quickly as possible in healthcare professions and to help our military community at the same time. This bill will require the Maryland Health Occupations Board to create an expedited temporary licensure, certificate, registration, or permit for service members, their spouses, and veterans who hold similar certifications in other states to join our workforce here in the state of Maryland. This legislation will be applicable in numerous fields and would help fill in a wide variety of critical healthcare professions, including acupuncture, audiology, dentistry, nursing, pharmacy, etc. The aim of this legislation is to create a mutually beneficial situation for both the state and for the military community who service the state of Maryland. And I see Mr. Arnold is there. So, Madam Chair and members of the committee, again, you've heard this piece of legislation. This is just another tool for the citizens of Maryland, particularly with our healthcare professional shortages in the state of Maryland. So with that, I will turn it over to my panelists and we will stand for questions and we ask for a favorable report.
Thank you so much. So Captain Lynn Nash from the Maryland Military Coalition. Thank you, sir, for sponsoring this bill at our request.
We certainly agree with everything here. We have three friendly amendments. The first is to remove the one-year application for veterans. So I left service in 2019 and this bill would not apply to me. I actually restarted my license here in Maryland. It took me 140 days. It expired after 6 weeks and I had to renew it again. That's just wrong. The second is the definition of reservist refers to armed forces. The U.S. Public Health Service is a uniform service. We have 5 ready reservists here in the state, and they would not be covered by this bill. And lastly, if you really want to fix this, how about joining the 5 states that have a same-day walk-through process? You walk in with your paperwork, you walk out with your license. It doesn't cost a lot of money to be able to do this, but we are surely short, and this bill will do a great deal to move us forward. And Mr. Arnold will talk about the Department of Defense and their work on this bill.
And Madam Chair, we do consider those friendly amendments, should have them coming to you shortly.
Thank you, Senator. And I guess now we're going to hear from Mr. Arnold.
Yes.
Madam Chair, honorable committee members, thank you for the opportunity to testify today on behalf of the Office of the Secretary of Defense. My name is Christopher Arnold, the Mid-Atlantic Region Liaison at the United States Department of Defense State Liaison Office, operating under the direction of the Undersecretary of Defense for Personnel and Readiness. We are grateful to Senator Jackson and the members of the Veterans Caucus for once again reintroducing this important legislation, which has crossed the Senate threshold 3 times over the last 3 sessions. Under the policies in the bill, a military spouse can obtain a temporary license in 15 days with minimal paperwork and documentation while they gather what's needed to pursue their full state-specific license. This allows them to begin working immediately and avoid months of delay. The individuals who would be covered by Senate Bill 3 may not be covered by the recent changes to federal license portability provisions in the Service Members Civil Relief Act for military spouses. Additionally, federal law now requires states to recognize a spouse's out-of-state license, but that doesn't translate to immediate jobs, with employers and insurers often preferring a Maryland state license. In a handful of occupations, the wait for a full state license can stretch on for months, leaving families financially stressed and spouses sidelined from their chosen profession. This bill changes that. Think of a nurse, their skills honed in another state, ready to serve Maryland communities. This bill says, go ahead, help now. We'll catch up with the paperwork later. It removes bureaucratic hurdles, not professional standards. It's not just about jobs, it's about stability. Military families moved often, and every stalled career is a blow to their well-being. This bill lets spouses build roots, contribute to their communities, and feel less like visitors in their own state. The policies reflected in Senate Bill 3 are vital to improving economic security for our military families and making Maryland the year of the military family in 2024. Thank you.
Thank you, Mr. Arnold. I think that ends all the favorable, and we'll certainly follow up on those amendments. So thank you very much for having. Oh, Senator Ellis, I'm sorry.
Thank you, Madam Chair. Thank you, Senator, for this bill. And in my previous life in the Senate of Maryland, I was on what is now known as the Triple E Committee.
Yes.
And there are at least 3 years we heard a bill like this, or we voted on a bill like this, and a bill like this passed. So my question is, why is it still here? What happened to those other bills we passed to allow service members and their families to have expedited license? And one of the issues was the, speaking with the Health Occupation Board's, the temporary license. And they said, well, we're so fast now, we don't need to give a temporary license, we get a permanent license. And so could you fill in the gaps with why we're still here with this issue?
Thank you for the question, Senator. I am really not sure. I think we've heard the opposition say that there is no reason for this bill because they move in such an expedited manner. But trust me, we would not be here each year if we did not still have those challenges. And I do believe this committee has been, or the previous committee was very amenable to trying to move the bill forward. And I think one year we may have had some challenges in the House, I'm not sure. But if Mr. Arnold or Ms. Nash can answer that, I am really not sure. I think we have such a challenge in our healthcare community. You and I had the conversation yesterday regarding our nursing shortages. If we have such a challenge that if there's anything that we could put, it's an enabling piece of legislation that allows us to draw on the resources that present themselves, that's presented to us here in the state of Maryland. I think we should take the opportunity to take advantage of that and to ensure that we have these highly skilled individuals who can perform the services. But I don't see where the challenges are. That's why we keep bringing the bill back.
Yeah,
So.
thank you.
I
Thank you,
can add a
Madam.
little
So-
bit of information
Okay,
to
yeah, if you
that,
could,
if I
Madam
can,
Chair,
before
thanks.
I call on Senator Hershey. 2 years ago, it did pass the Senate. Had a hearing in the House, did not get voted out of the House committee. Last year, we didn't get it out of Senate Finance for whatever reason. Maybe we ran out of time. And this year, again, there's no cross file in the House, so it'll have to, get over after we pass it, which can slow things down a little. So I don't know if it would help maybe to get a cross file, but that's the history for the last 3 years.
And last year also, the recommendation was to do a study on expedited licensure rather than pass the bill out. Senator Griffith, Delegate Griffith, sponsored that amendment, and I'm not sure where the study part of it is.
Yes, last year the bill was converted into a study, and we are working with HGO in terms of having a cross file introduced before the 9th, which is their 31st day. So, Senator, the underlying concerns of military spouses have not been resolved by some of the previous steps that Maryland has taken, quite frankly. So we pursue a variety of approaches to reciprocity simultaneously. We perceive interstate compacts are sort of our optimum end state for instant portability, but as there's not a compact for every occupation, nor is each state a member of every compact, we still pursue the bottom line effort of getting a state license in 30 days with minimal paperwork and minimal documentation. The evidence that we have about the quality benefits of licensure relate to occupations such as the health occupations, which tend to have more harmonized standards across states. There's no strong evidence to suggest that the type of license recognition in Senate Bill 3 is associated with worse quality or worse care outcomes. It's something that many states have done, and while it likely affects a relatively small number of applicants, it is an improvement in the right direction.
Thank you, Mr. Arnold. And I see no other questions, so that ends this panel. We do have Deborah Bricado favorable with amendment.
Thank you, Madam Chair.
Thank you.
Hello again, Deborah Bricado with Maryland Right to Life. And again, we would like to request an amendment so that this bill is not used for abortion purposes. Certainly, we would like to help our military in their employment. But also already the Abortion Care Access Act did remove a level of safety by removing the physician requirement. We would hope that expedited licensing requirements do not further lower that level of safety. But we also would not want this bill to be used to exploit the military in order that we're supplying the abortion industry with their workforce. So for those reasons, we do ask for an amendment to exclude abortion from this bill. Thank you very much.
Thank you, Ms. Bricado. And last, I have Michael Tran unfavorable, if he's here. Is Michael Tran here?
Good afternoon, Madam Chair, Madam Vice Chairs, and committee members. My name is Michael Tran, Health Policy Analyst at the Maryland Board of Physicians. The board would like to thank Senator Jackson for sponsoring Senate Bill 3. We strongly support the initiatives that ensure the effective and expedited licensure of military members, veterans, and military spouses. However, the board is respectfully opposing this legislation. The committee has the board's letter of concern as well from the various other boards. So I'll just stick to the main talking points. The board has a licensure goal of issuing 95% of licenses within 10 days of receiving all qualifying documents. That goal has been consistently exceeded within the past several years, with 99% of licenses issued within that 10-day timeframe. On top of this, military applications are already the priority of any application that the board receives, mandated by the Veterans Full Employment Act of 2013. Military applications are the first to be processed and the first to be licensed once deemed completed by staff. Additionally, the recent change of federal law requires the board to allow portability of professional licenses for qualified military members and their spouses, federally exempting those qualified from Maryland licensure altogether. The board would also like to highlight its current efforts in drafting regulations that allow qualified military members, veterans, and military spouses to apply for waivers concerning licensing fees, continue medical education, and renewals. While the board supports the intent of SB 3, adding temporary licenses would present a significant burden to both the applicant and to the board without reducing the time or cost to obtain a license. For those reasons stated, the Board of Physicians would respectfully urge the committee for an unfavorable report on Senate Bill 3.
Thank you, Mr. Tran. Is it Mr. Tran or Dr. Tran?
Mr. Tran.
Thank you. And Senator Hershey?
Thank you, Madam Chair. Mr. Tran, obviously, I think, as you can tell, it's passed this committee a few times, so it's very favorable in here, but we'd certainly like to hear why there's a discrepancy in, I think, the sponsor's testimony and your testimony, and, you know, whether this is a perceived problem that, you know, you're saying licenses are getting out within 10 days, 90% of them. And yet the bill creates a new temporary license that you're also saying is not necessary and would slow down the process. So what's, you know, help us out. What's really going on, and, you know, why does the sponsor feel that we need the legislation, yet you're coming in and saying we don't?
Yes, sir. Thank you for the question. So with Senate Bill 3, and my answer is just going to be in respect to the Board of Physicians. I can't answer for the other boards. However, we do, as from my testimony, we do issue licenses in 99% of license within that 10-day time frame. We move quickly. We have a lot of pathways to licensure. And there are just, these applicants have multiple ways that they can get to licensure in a very specific timeline. With the other aspect of your question, that the discrepancy there, we don't believe that temporary licenses are going to make things move a little quicker. With Senate Bill 3, the applicant's going to have to complete, submit, and pay the fee for a temporary license, and then complete, submit, and pay the fee for a full license, which means the board would have to process, issue a temporary license, and then process and issue a full license. We don't think that's necessary if we're already issuing licenses within 10 days. It's just adding a step when the whole process is actually pretty short for the Board of Physicians.
Okay, so if I understand that, if you're saying you're speaking from the Board of Physicians and your letter of opposition comes from the Board of Physicians, but then you also say, along with acupuncture board of dental examiners, massage therapy examiners, you go on, are all of those included in your statement of getting the temporary licenses out within 10 days?
So all those boards were a part of our letter and they did sign off on it. I can confirm that that is the timeline for the Board of Physicians, but I can't speak to their half, but they are a part of the letter and they did sign off on it.
Okay, but that might not mean that they're getting out their licenses within 10 days. You're not confirming that, are you?
I cannot confirm that, but they were able to see the letter and wanted to be a part of it, and they did sign off
Want
on
to be
it.
a part of the opposition, so it might be. So, okay, well, thank you very much.
Yep.
Appreciate it.
Thank you, Senator Hershey. We have, if there are no other questions, oh, there is another question. Senator Ellis.
Chair. Okay, and thank you, Mr. Tran. So if someone comes to the board, the military spouse who's a MD, say want a license in Maryland, why does the board have to create two paths, one application for a temporary license, one for a permanent license if this bill passed? Why not just they apply for a license, and you give them a temporary and work on a permanent? Why do they need two application portals, two fees? Isn't that a regulatory requirement that you all control? Could you just get rid of the temporary application process? You apply for a permanent license. While we do all our paperwork, you get a temporary license on the way to the permanent. Isn't that possible?
So under Senate Bill 3, I believe that the requirements for applying for a temporary license, you also need to have submitted a application for the full license. Within our process right now, we just have that process for full licensure. But when it comes to the fees, we would have to require fees to support a temporary license. However, with that being said, we are in the works to promulgate regulations to have fee waivers for military applicants, veterans, or military spouses as well.
So then one application, is there two applications?
Currently, it's one application, but with the Senate Bill, with Senate Bill 3, there would be two applications required under the legislation.
Does this bill require two application process?
I believe to apply for the temporary license, you also have to have proof that you also applied for the full licensure, and then have proof of submitting criminal history records check, as well as having a valid license in another state.
Okay. I'd love to follow up with you with that to see where the bill calls for that. And if necessary, tweak it a bit so it's just one application. And on the way to permanent licensure, they can get a temporary. So it's seamless, okay? If you could follow up with me with that and show me.
Of course, Senator.
Okay.
I would also like to note, under the federal legislation that passed around this time last year, military members and their spouses who are qualified can register with the board for an exemption to licensure. So for those specific applicants, they can practice under that exemption while they wait for their full licensure, which also is expedited and usually only takes 10 days.
Okay. Well, thank you.
Thank you, Senator. And our last witness is a virtual witness, Michael Olsick.
Mark Olsick, Senator.
You're right, Mark. Thank you.
You're welcome. So I would just echo what Mr. Tran said. I'm the vice chair of the Maryland Board of Physicians. I would just reiterate that the board already expedites licenses for service members and family. As he said, federal law eliminates the need for temporary licenses by providing the exemption, and they won't speed up the process. I'm also a veteran of the Navy, and active duty members do not need to be licensed in the state that they practice if they're at a federal facility. I had a California license. I was transferred to Naval Hospital Great Lakes. I could still practice there at a federal facility with my California license. So as long as you're licensed in one of the 50 states or U.S. territories, as an active duty member practicing at a federal facility, you do not need to have a licensure in the exact state. If you wanted to moonlight, or if your spouse wanted to work, then you would need a license. But transfer of station is usually known well in advance, and the application could start well before our 10-day period where we grant 90% of the licenses. So this would, complicate matters by creating a new category of temporary licenses, as Mr. Tran said. So it actually creates more work for very little, if any, added benefit without any to active duty members who are solely practicing at a federal facility.
So it's Dr. Olsick, correct?
Yes, correct.
Thank you. How long have you been practicing in Maryland?
I've been here for 16 years.
So back then, did you get your license fairly quickly?
I did. Yeah, before I even moved my residence.
Even 16 years ago. And you currently serve on our Board of Physicians?
I do.
Thank you. Thank you for your testimony. Do I have any other questions? Thank you very much.
Thank you.
This ends our hearing on Senate Bill 3, and it ends our day today in Finance Committee. Thank you all for participating.